Hello, viewers. We welcome you again to another episode of the Pew and the Pulpit, coming to you live from this studio and from the Anglican Church of the Holy Spirit here in the Bronx, New York, United States. I have a guest today, as always, our own Dr. Somechupu Onoha, a medical practitioner and very committed Anglican. Doctor, you are welcome to this program.
Thank you.
How are you doing today?
I'm doing good.
It's been a while. Anyway, today we want to discuss another important health issue in our society today. And the important thing is that it even affects Anglicans and non-Anglicans, Christians and non-Christians. So we are concerned today that some of our church members, even some church fathers, may be going through this topic, and it is prostate cancer in men. So, Doc, what is prostate cancer?
Thank you very much, everyone. I welcome you all to this, our educational topic again. It's my pleasure to once more be involved. Prostate cancer, that's what we're going to be discussing today. And especially for the men, I want everyone to listen very attentively. So what is the prostate? I'd like to start from the little parts of it so that we can carry everyone along. The prostate is an organ that is in the lower part of the abdomen, precisely in the pelvic area. This organ is the size of a walnut. That's how it's described. It's in terms of dimensions, it's about 4 centimeters by 3 centimeters by 2 centimeters in depth. It weighs about 25 grams, and in terms of volume, it's between 20 and 50 cc's in volume. So that is the prostate. This prostate is an organ that is found only in men. Unfortunately, women do not have prostate, so they don't have any problem associated with the prostate. So, prostate cancer. So there are 3 major problems or health problems that we have with the prostate. One of them is benign prostatic hypertrophy, what we call BPH. The other one is prostatitis, and the other one is prostate cancer. So of all of them, the most devastating and the most serious is prostate cancer, and we decided to talk about it today. So what is prostate cancer? Prostate cancer, simply put, is a cancerous growth in the prostate, that is in this organ. And also, just to mention, this prostate has lobes. There's a right lobe, there's a left lobe, there's a median lobe. So cancer of the prostate means cancerous cells growing in the prostate. These cancerous cells can grow at any age, but the risk of prostate cancer is more in men with advanced age. Rarely men below 40 years, we don't see it. The incidence is about 0.5% in those below 40 years. But as we grow older, between 50 and 69 years, the incidence goes up about 15%, and above 80 years and 90 years, it's about 80%. Prostate cancer is one of the diseases that we say that men who have prostate cancer, especially at advanced age, die with it. They do not die as a result of it. That is for people at advanced age, but not people who are having prostate cancer at a younger age. So in a nutshell, it is a cancerous growth of the prostate, this organ that is in the pelvic area. It's commoner in men with increasing age, and also in some other groups, which I'll mention as we get along.
Okay. Wow. So like I said, this disease, like the doctor said, this disease is for men. That doesn't mean that women won't pay attention in this edition, because it will help you guide your man, right? So, Doc, what are the risk factors?
Okay, risk factors for prostate cancer. Like one, as I mentioned, is age. If you have any way of keeping yourself from not growing older, that would be good. If you can peg your age and not go beyond 50 years, probably you have nothing to do with prostate cancer. But unfortunately, we can't hold our ages. So increasing age increases your risk of prostate cancer. That's one thing. African American. So being black, the risk of prostate cancer is increased in black population groups. Other things that could lead to increase in prostate cancer are things like smoking. So we all know smoking increases the risk of so many things. Prostate cancer is one of them. Exposure to ionizing radiation has been also known to increase the risk of prostate cancer. In some people, some dyes have been known to also increase the risk of prostate cancer. So in all, still, the most significant thing is increasing age. That increases the risk of prostate cancer.
Wow. When you say the radiation, can you throw more light about radiation?
So radiation, so basically, one is ionizing radiation. So we all know historically in the Second World War, when the atomic bomb was thrown in two cities, Hiroshima and Nagasaki, and some other areas where people have been exposed to ionizing radiation. This has been known to increase the risk of prostate cancer and some other cancers. So, but these are from some of the studies that were done. But like I said, it's not the major risk. The major risk is just increasing age. But these are some of the things.
Okay. What are the symptoms? Does it have symptoms at all?
Yes, symptoms of prostate cancer. Yes. So one thing is a good number of people do not have any symptoms. So in terms of presentation for prostate cancer, it could go from asymptomatic, that's people who don't have any symptoms, to people who have symptoms. And then one will ask, what are these symptoms? Okay, so the symptoms in medical practice, there's something we call the prostate symptom index. Some people call it the lower urinary tract symptoms, LUTS, L-U-T-S. So these are the symptoms that occur when we have problem with the prostate. And this can start at any point in the disease. It could be at the early stage of the disease, but most times as the disease progresses, then you have these symptoms. Now, like every cancer, what happens is that cancer comes most times with other symptoms, like weight loss, like change in our energy level. We could have fatigue and many other things, which generally will occur as a result of some disease coming and most times cancer. So we could see things like weight loss. But going to the lower urinary tract symptoms, as I mentioned, so these symptoms occur due to there is a change in the urine flow, which could be the effect of the prostate cancer itself, or it could be as a result of the spread of the cancer. So either the local effect of the cancer or the spread of the cancer. So what are the local effects? Local effects could be these cancerous cells are impinging on the urethra, which is the tube that gets the urine out of the bladder. Or it could be due to what we call hematogenous spread. So when you have cancer, this cancer can move from the organ that is primarily involved into the bloodstream and go to various areas in the body. And also the cancer could spread by lymphatic spread through the lymph nodes. Any of these ways could now manifest because of the effect on body areas which could be near the prostate or away from the prostate. So some of the pressure effects could be what we call the lower urinary tract symptoms, which would be effects that could be due to the mass, which is the pressure effect. So people could have what we call nocturia. Nocturia means they are going to pass urine in the night more than twice. So every normal person should, if you have to go and urinate at night, it should be once or maximum twice, not more than twice at night. Then that's one. The other one is people could have frequency. So during the daytime, they are going to urinate so many times. Or it could be urgency. Urgency means that they want to urinate and they can't hold, they have to go immediately. Then there could be other symptoms as a result of what we call the dynamic problems. And this could be things like hesitancy, intermittency, weak flow, or incomplete emptying. So, in a nutshell, the symptoms of prostate cancer could move from no symptom to many symptoms, and some of these symptoms could come as lower urinary tract symptoms. And also the general effects like the weight loss, the fever could also occur at the same time. And like I said, some people may not have any symptoms. It's only due to routine checks that this will be found out.
Yeah, it's been wonderful listening to you, Dr. Some. Are there any screening tests How do you dictate it? How do you screen it?
Thank you very much. So screening test. This has been a contentious issue. I'll go back to historical background in science and what has happened. Because everyone is scared about anything cancer. Once you mention cancer, we're all scared. So in 2010, here in the United States, so some regulation came out and there were several studies on what should we do. Because prior to this time, there was some confusion as to who do we screen, who do we not screen. And like I mentioned earlier, most men have prostate cancer. They die with the cancer, not of the cancer. So you can imagine that something you're going to die of, and somebody starts treating you, and you develop side effects or complications from surgery, which is something that over your lifetime may not have come up. So because of this, there was research. And in 2010, the body of research and the evidence here in the United States stated that there was no effect in treating as against, in screening as against not screening for people age 50 to 69, which would be the main group of people where you're worried about. A similar study in Europe at that time saw that there was advantage in screening. That if you screen people between 50 and 69, that there was a 20% reduction in the risk of mortality, that is death, as a result of prostate cancer. So if you caught early people who had this cancer and treated them, you reduce the risk of death. So there was still more confusion in it until 2012. Here again in the United States, in the prostate, lung, colorectal, and ovarian cancer surveillance screening study now did an extensive study. And then the United States Preventive Services Task Force came with a recommendation, and they termed it Recommendation D. Recommendation D meaning that do not screen. That screening could lead to harm and there's no benefit. And what this means is that if you're age 50 to 69 here in the US, that screening for prostate cancer will be a discussion between you and your doctor. The doctor will explain to you that screening at this stage could lead to finding out something, for example, that prostate cancer, which if you get treatment, you could have some harm from this treatment, and this prostate cancer is something that may not kill you. So we term it Recommendation D, and Recommendation D in our research world means screening is not beneficial, and screening could cause harm. So unless people who have high risk, so somebody is black, somebody has family history, first degree relative that has prostate cancer, then these are people you screen. But otherwise, the general population, you explain to the patient and say, these are the risks. We can screen. Whether we find it or we don't find it, this is what the recommendation is. That's the screening. Then what are these screening things that we do? PSA is one of them, prostatic specific antigen. Digital rectal exam, which your doctor does with a finger, goes with a finger into your back passage, your anus, where you defecate from, is another screening, the two main screening tests. Digital rectal exam, the doctor puts a finger, usually is the index finger, or the index and the middle finger. Go into your back passage, try to palpate the prostate. The doctor is looking for irregularity or nodes in the prostate. And if these things are found out, then we proceed with the PSA, which is the prostatic specific antigen, which we normally do. And this PSA, they are magic numbers. So the PSA is normally ranging from 0 upwards. So normally you want it to be between 0 and 5, which we say you're in the safe area. If it's anything between 5 and 10, we say you're in the danger zone. And if it's anything above 10, we get really worried that your risk of prostate cancer is higher. And at this stage, if your digital rectal exam is showing nodules or irregularity, or anything to be concerned about, or the volume is high. Remember, I told you the volume is about 20 to 50 or 70 cc's. And the prostatic specific antigen is high, or even 5, you're in the danger zone. A biopsy is recommended. And this biopsy is normally transurethral biopsy or needle biopsy of the prostate. And this biopsy is pretty invasive procedure where the doctor is going to put in a needle to take a chip of your prostate. They take it to the lab. And when they take it to the lab, they now do a histologic test to determine, do you have prostate cancer? And if you do have, at what stage it is. So.
Wow. How do you diagnose prostate cancer?
Like I said, once you take a chip of the prostate and you take it to the lab, you get what is called a histologic diagnosis called the Gleason score. The Gleason score is a score that grades prostate cancer from 1 to 5. 1 means well-differentiated cancer, so you are at the very early stage of the cancer. 5, poorly differentiated, means advanced stage of the cancer. Second modality of histologic screening is what we call the Gleason score. Gleason score is the basic one that we use for the histologic staging. The other staging is the clinical staging. Clinical staging is now based on the examination the doctor has done, the tests that we've done. So like the imaging test, because once we're concerned about your prostate, then we do radiological testing like CT scan, ultrasound, MRI, to know, do you have nodes that are enlarged? Has there any signs to show that this disease has gone beyond your prostate? So with the examination, clinical exam, with the test that we've done and the result of your PSA, we now come to a clinical diagnosis which gives us a staging. There are 2 forms of this staging. One is what we call the TNM staging. T stands for tumor, N stands for node, M stands for metastasis. TNM staging. This TNM staging, as the 3 things go, shows the size of the tumor. Do you have any metastasis? Are there any nodes that are involved? With this, they grade it. Then the other one is with the one we call the Jewett-Whitmore staging, which is also another form of clinical staging. This staging and the result of your test give us an idea whether you have prostate cancer and what stage.
Wow. This is incredible. Excellent. You see, most people may be suffering from prostate cancer without knowing it. It is advisable. We from the Anglican Church of the Holy Spirit advises you to see your doctor if you are 50 and above. It is better to prevent these diseases than to leave yourself and get sick. Doctor, how do you manage it? Managing prostate cancer, like I said, so number 1 thing is you manage the symptoms. Like I told you, if somebody has lower urinary tract symptoms like hesitancy, urgency, frequency, nocturia, dribbling, or incomplete emptying. So few things that you do. Activity planning. You tell them about not drinking so much water in the evening. Anything from 4 p.m., drink less water. You plan the food they eat, you give them advice. Then other medical conditions that they have. Of course, when you've done the tests, you see if they have any other problems that you'll address. You manage their diabetes, you manage their blood pressure. Then the next thing will be in terms of treatment. What do you do? What stage of the cancer do they have? If it's stage 1, what we call localized disease. Localized disease, there are 3 things we do, what we call watchful waiting. So you wait and repeat the scan every 3 to 6 months to see where they are, your digital rectal exam and the PSA. The second one is now treatment. Most people will have radical prostatectomy, so the surgeon removes the prostate. Third one will be radiation treatment. So the radiation treatment, there are various forms of them. We have what we call the brachytherapy, which is the seed implant, and we have the one we use radiotherapy, which is radiation. Then if you have a locally advancing disease, so you have a disease but is now advancing, which is the medium one. So what we do, we use androgens. Prostate cancer is a cancer that is dependent on hormones. So we tend to block these hormones so that we reduce the growth of the cancer. Remember, when you have this disease that is advancing, nobody's now talking about surgery because it's gone beyond what we can cut out with surgery. Then the last one is a very advanced disease. So very advanced disease, then of course we use anti-androgens. We use growth hormone blockers. So medication that will block the hormone that is feeding this prostate cancer at various levels. Wow. So what is your general advice to the public?
General advice to the public is this. Prostate cancer screening, like I mentioned, if you're somebody that has risk factors, you're African American, you have a first-degree relative that has a history of prostate cancer, discuss this with your doctor. Screening will be helpful to you, especially if you're between 50 and 69 years. But if you're in the risk group and even you're younger and you're worried, talk to your doctor. Screening will be beneficial to you. If you're not within the risk group, it will not really be beneficial to you, but it's all up to you. We have our personal experiences and what we are afraid of. If you're very worried about it, talk to your doctor. You can get the screening. There is no problem with that. Then also for our men, just it's good for us to know that sometimes we have these urinary symptoms. We're going to the bathroom so many times. It's good for us to know that the prostate is a gland which we have. It could be the cause of this problem. It's good to check it out. It's good to talk to the doctor when we see the doctor. Early detection is better, but in a nutshell, prostate cancer is something, there are some treatments. It's a cancer.
I mean, we'll continue with another episode. If we look, for me, this is Professor Sobe Onoha. I want you the title of our own professor here. Doctor have done great job this day to talk about prostate cancer, and it's a disease we must all pay attention. Keep watching ACNN. Thank you and remain blessed.
Thank you very much.
Hey, I welcome you to the Pew and the Pulpit, coming to you live from the Anglican Church of the Holy Spirit, Bronx, New York. The address is 3840 Seaton Avenue, off 233rd Street, when going towards the highway. And the address is, the zip code is 10466. 10466. Our email address is Anglican Church of the Holy Spirit at yahoo.com. Email us at Anglican Church of the Holy Spirit at yahoo.com. The phone to reach the church by phone, 929-944-3424. 929-944-3424. Come, we worship every Sunday at 11 a.m. It's just a 2-hour service. We are a live and happening church here in the Bronx, New York City, and in the center of New York City. And we are a welcoming congregation. We worship in English. All is welcomed, but we do not believe in gay marriage. So don't come expecting to be wedded in our church, because it's not part of our tradition. We are part of CONAM. CONAM is Church of Nigeria Mission in North America. So we're a full-fledged Church of Nigeria Mission here in America. Come and be blessed. Thank you.